My name is Malton Schexnayder, and I am the creator and founder of the Erase Your Back Pain program. And today what I'd like to do is to go over a very commonly diagnosed condition that many of you may have been actually diagnosed with. And that is the condition that is referred to as degenerative disc disease. Sometimes you'll see it abbreviated as DDD. And one of the confusions that takes place is that when anybody sees a condition that is referred to as a disease, they often think of, oh my God, this is horrible, I've got a disc disease. Well, that's kind of a misnomer. I mean, it's not that you have a disc disease, it's that the discs themselves have started to change in their character. And many of these changes are related to aging. As we get older, the discs and any other tissue in our body, for that matter, begins to change. Now, before we get into some of the aspects of degenerative disc disease, I want to talk to you a little bit about the anatomy. The spine itself is composed of 24 moving vertebrae. And the vertebrae are stacked one on top of each other, and they typically move by a pair of joints at each level. There's a pair of joints at each level here. And so you've got this pair of joints on the back side of each spinal segment, and then on the front side you have a joint that's formed between the two bony bodies here and the disc here in between. This gray structure right here is the disc. Now, the disc itself is basically a ring of connective tissue, and it's kind of got 12 to 14 concentric rings of essentially cartilage that surround a central nucleus, and that nucleus is made up of a jelly-like substance. Now, the disc receives its nutrition in the early ages, but from childbirth to teen ages, by an active blood supply. But after adolescence, that blood supply goes away, and the disc actually receives its nutrition in the adult by absorbing fluid, typically water, that is coming from the vertebral body below it and the vertebral body above it. So it basically, through osmosis, basically draws fluid into the disc. That's how the disc gets its nutrition, and because of the water that's being absorbed into the disc itself, the disc will maintain some height to it. As we age, however, that process becomes diminished. So the ability of the disc to take in fluid becomes smaller and smaller, and over time that jelly-like nucleus, which is at the center of the disc, changes in character. It goes from a jelly-like semi-fluid type of consistency to a more fibrotic or fibrous type of consistency. So over time, that disc begins to lose its ability to take in water, take in fluid, and as a result, the height of the disc begins to shrink. Okay? Now, that process of disc shrinking, or the height changing, is referred to as degenerative disc disease. Now, in addition to that, what will happen is that as the disc begins to lose its height, it may be squeezed on the backside, causing it to push into these exiting nerve roots here, okay? And as a result of that, that is called a disc herniation, or a herniated disc, or a protruding disc, or a bulging disc. All of those terms are basically interchangeable. But basically what they refer to is that the disc is pushing into the nerve and can create some irritation to the nerve. Now, interestingly enough, When we start to take a look at patients that present to us with lower back pain, perhaps some pain that is going into their buttocks and down the leg, we start to automatically assume, at least historically, we automatically assume that that condition was a result of a herniated disc. It was encroaching upon the nerve, it was causing some nerve irritation, and so therefore you got some pain that would run down the leg. There have been study after study after study that has reviewed this whole degenerative disc process, and what we now know is that if we take 100 people off the street who were having absolutely no pain whatsoever, and we were to run them through an MRI scan or a CT scan, as high as 85% of those people would have some diagnostic evidence of some degenerative disc disease or some bulging disc. So what we know now about degenerative disc disease is that it is a normal consequence of aging. It is not a disease that you need to get too terribly worried about. It is strictly a consequence of aging, typically. Now, how do you go about treating it? We can diagnose degenerative disc disease very easily, either through X-ray by looking at the spacing between the two bones, and if it starts to narrow, we know that there's some degenerative disc problems going on there. We can also obviously get further diagnostic evidence by MRI or CT scan. But how do you go about treating it? Well, surgery is an option that is only reserved for about 5 to 10% at the very most of patients presenting with this problem, interestingly enough. So what we need to be able to do is not treat the degenerative disc problem itself. What we need to be able to do is to calm down everything around it that got it into that situation in the first place. If there is acute nerve irritation going on that we can establish, then sometimes an epidural injection is very helpful in resolving that problem. The other thing is that although we can't change or reverse what has happened at the disc itself as a result of the aging process and as a result of the changes, what we can do is change the environment that the disc is functioning in to slow the process down. And by that I mean we can introduce movement through here, because that's how the disc and the spine gets its nutrition, through movement. And we can change the character of the muscular system that is around it by improving the balance of these particular muscles. So in other words, there are muscles that can affect this area here by either tightening or weakening. We need to be in a position to assess that, determine which muscles are tight, which muscles are weak, and then implement the appropriate treatment program that's going to best meet the needs of the patient and the needs of the condition that is the patient is presenting with. So I hope you found the information I provided you today on degenerative disc disease and disc herniation useful, and I hope that it is something that you can utilize in your pursuit of pain relief. If you'd like some more help or some more information about how my program might be able to help you in your pursuit of your particular situation, then I'd like you to go ahead and click the link you see right below this video, and I'll be happy to help you. This is Mountain Schexnayder wishing you all good health, and I do hope our paths cross soon.